What causes gum disease? Gum disease, also known as periodontal disease, is primarily caused by bacterial infection and inflammation of the gum tissues surrounding the teeth. The main culprit is a buildup of plaque, a sticky film of bacteria that forms on teeth and gums. Plaque contains bacteria that produce toxins, which can irritate the gums and lead to inflammation. There are two main stages of gum disease. Gingivitis. This is the earliest stage of gum disease and is characterized by redness, swelling, and bleeding of the gums, especially when brushing or flossing. Gingivitis is primarily caused by poor oral hygiene practices, allowing plaque to accumulate and bacteria to flourish along the gum line. Periodontitis. If gingivitis is left untreated, it can progress to periodontitis. In this stage, the infection can spread below the gum line and lead to the formation of pockets between the teeth and gums. These pockets become sites for more bacterial growth and can eventually cause the destruction of the supporting structures of the teeth, including bone. This can lead to tooth mobility and even tooth loss. Several factors can contribute to the development and progression of gum disease. 1. Poor oral hygiene. Inadequate brushing, flossing, and regular dental checkups can allow plaque to accumulate and lead to gum disease. 2. Smoking and tobacco use. Smoking weakens the immune system and reduces blood flow to the gums, making it harder for the body to fight off infections. 3. Diabetes. People with diabetes are at a higher risk of developing infections, including gum disease. 4. Hormonal changes. Hormonal fluctuations during pregnancy, menstruation, and menopause can make gums more sensitive and susceptible to gum disease. 5. Medications. Certain medications can reduce saliva flow, which plays a protective role in maintaining oral health. 6. Genetics. Some individuals may be more genetically predisposed to developing gum disease. 7. Poor nutrition. A diet lacking in essential nutrients can weaken the immune system and compromise gum health. 8. Medical conditions. Certain conditions such as HIV/AIDS and cancer can interfere with the immune system and increase the risk of gum disease. 9. Bruxism. Teeth grinding. Grinding or clenching the teeth can put excessive force on the supporting structures of the teeth, potentially exacerbating gum disease. Prevention and treatment of gum disease involve maintaining good oral hygiene practices, quitting smoking, managing underlying health conditions, and visiting the dentist regularly for professional cleanings and checkups. In more advanced cases, dental procedures such as scaling and root planing, antibiotics, and surgical interventions may be necessary to manage and treat gum disease. What are the symptoms of gum disease? Gum disease, also known as periodontal disease, can present with a variety of symptoms, ranging from mild to severe. It's important to be aware of these symptoms so that you can seek prompt treatment if necessary. Here are some common symptoms of gum disease. 1. Bleeding gums. One of the earliest signs of gum disease is often bleeding gums, especially when you brush, floss, or eat hard foods. Healthy gums should not bleed during regular oral hygiene activities. 2. Redness and swelling. Inflamed gums may appear red, swollen, and tender. They might feel sore to the touch. 3. Bad breath. Persistent bad breath, also known as halitosis, can be a result of the bacteria present in gum disease. The bacteria release foul-smelling gases as they break down food particles and other debris. 4. Receding gums. As gum disease progresses, the gums can start to pull away or recede from the teeth, creating a larger portion of the tooth surface to be exposed. This can also make teeth look longer. 5. Pockets between teeth and gums. In advanced stages of gum disease, pockets can form between the teeth and gums. These pockets may trap food particles and bacteria, leading to further infection and damage. 6. Loose or shifting teeth. Gum disease can affect the supporting bone structure of the teeth, causing them to become loose or shift in position. This can affect your bite and overall oral health. 7. Changes in tooth alignment. Teeth that were once well aligned may start to shift or become misaligned due to the changes in the supporting bone and gum tissues. 8. Pain or discomfort. You might experience pain or discomfort while chewing, brushing, or flossing. This can be due to the inflammation and infection in the gums. 9. Gum sensitivity. Gums affected by gum disease can become more sensitive to temperature changes and certain foods. 10. Pus or abscesses. In some cases, gum disease can lead to the formation of pus-filled pockets or abscesses between the teeth and gums. These are signs of a more severe infection. It's important to note that in the early stages, gum disease, gingivitis, may not always cause noticeable pain or discomfort. Regular dental checkups are crucial for detecting and treating gum disease in its early stages, before it progresses to more severe forms, periodontitis, that can cause irreversible damage to the teeth and supporting structures. If you notice any of these symptoms or have concerns about your gum health, it's recommended to schedule an appointment with a dentist or periodontist for a thorough evaluation and appropriate treatment. What is the difference between periodontitis and gingivitis? Periodontitis and gingivitis are both stages of gum disease, periodontal disease, but they differ in terms of severity and the extent of damage to the gums and supporting structures of the teeth. Understanding the differences between these two stages is important for maintaining good oral health. Gingivitis. Gingivitis is the earliest stage of gum disease and is characterized by inflammation of the gums, gingiva. Due to the accumulation of plaque, a sticky film of bacteria, along the gum line. While gingivitis is common, it is usually mild and reversible with proper oral hygiene practices and professional dental cleanings. Symptoms of gingivitis include 1. Bleeding gums. Gums may bleed during brushing, flossing, or eating. 2. Redness and swelling. Gums appear red, swollen, and may be tender. 3. Bad breath. Persistent bad breath is often a sign of gingivitis. 4. Gum sensitivity. Gums may become more sensitive to touch, temperature, and certain foods. 5. No permanent damage. Gingivitis does not cause permanent damage to the bone and tissue supporting the teeth. With timely intervention, gingivitis can be reversed by improving oral hygiene habits, such as regular brushing, flossing, and professional dental cleanings. Periodontitis. If gingivitis is left untreated, it can progress to periodontitis, which is a more advanced stage of gum disease. Periodontitis involves deeper inflammation and damage to the supporting structures of the teeth, including the bone. Symptoms of periodontitis include 1. Gum recession. Gums start to pull away from the teeth, forming pockets between the teeth and gums. 2. Tooth mobility. Teeth may become loose or shift in position. 3. Pain and discomfort. Discomfort or pain can occur while chewing, brushing, or flossing. 4. Pus and abscesses. Infection may lead to the formation of pus-filled pockets or abscesses. 5. Bone loss. The bone supporting the teeth can be damaged or lost, leading to irreversible consequences. Periodontitis requires more extensive treatment, which may include deep cleaning procedures like scaling and root planing, antibiotics, and sometimes surgical interventions. While the damage caused by periodontitis cannot be fully reversed, its progression can be halted and managed with proper treatment and ongoing maintenance. In summary, gingivitis is the milder and reversible form of gum disease, primarily characterized by gum inflammation and bleeding. Periodontitis is a more advanced stage with deeper infection and damage to the supporting structures of the teeth, including bone loss. Regular dental checkups, good oral hygiene practices, and timely intervention are key to preventing and managing both gingivitis and periodontitis.